What is first aid? First aid is the first aid and immediate assistance given to any person suffering from either a minor or serious illness or injury, with care provided to preserve life, prevent the condition from worsening or promote recovery. It includes initial intervention in a serious condition prior to professional medical help being available, such as performing CPR while waiting for ambulance, as well as the complete treatment of minor conditions such as applying a plaster to a cut. First aid is generally performed by someone with basic medical training. The purpose of first aid is to minimize injury and future disability. In serious cases, first aid may be necessary to keep the victim alive. What is being first aider means? Being a first aider, therefore, carries a range of different and incredibly important responsibilities. If you are a trained first aider and you think someone needs your help, there are numerous responsibilities that you should adhere to. What are the responsibilities of a first aider? Number 1 is assess the situation quickly and calmly to get an understanding of what happened. This involves determining whether anyone is in danger, the cause of the situation, and how many people are affected. Number 2, comfort, reassure, and calm, take charge. You should introduce yourself to the casualty, explain what's happening and why, and explain what you are going to do before you do it. Number 3, protect yourself and the casualty from any danger. You should always protect yourself first and only move the casualty if leaving them without cause more harm. If you are unable to make an area safe, call for emergency help. Number 4, prevent infection between you and them. You should wash your hands or use hand sanitizer. Wear disposable gloves and not cough or sneeze over a casualty. Number 5, give first aid treatment such as CPR or applying pressure to bleeding wounds. Life-threatening injuries and conditions must be prioritized before giving treatment for less serious cases. Number 6, arrange the right kind of help. Call for an ambulance if it's serious or send them to a hospital if serious but unlikely to get any worse. For less serious condition, suggest they are need to see doctor. If they are concerned of condition worsen, you should always stay in them until you can leave them in the right care. General guidelines in administering first aid and procedure for emergency action principles. Number 1. Before administering care to an ill or injured person, check the scene and the person. Size up the scene and form an initial impression. Pause and look at the scene and the person before responding. Answer the following question. Is the scene safe to enter? What happened? How many people are involved? What is my initial impression about the nature of the person's illness or injury? Does the person have any life-threatening conditions such as severe life-threatening bleeding? Is anyone else available to help? Number 2. If the person is awake and responsive and there is severe life-threatening bleeding, obtain consent. Tell the person your name, describe type and level of training, state what you think is wrong and what you plan to do, and ask the permission to provide care. Tell a bystander to get the AED and first aid kit. point to a bystander and speak out loud. Use appropriate PPE. Put on gloves if available. Interview the person. Uses sample questions to gather more information about signs and symptoms, allergies, medication, pertinent medical history, last food or drink even leading up to the incidents. Conduct a head-to-toe check. Check head and neck, shoulders, chest, and abdomen, hips, legs, and feet, arms, and hands for sign of injuries. Provide care consent with knowledge and training according to the condition you find. If the person appears unresponsive, shout to get the person's attention. Using the person's name if it is known. If there is no response, tap the person's shoulder if the person is an adult or child, or the bottom of the person's foot if the person is infant, and shout again. While checking for normal breathing, check for responsiveness and breathing for more than 5 to 10 seconds. If the person is breathing, send someone to call emergency hotline for the designated emergency number and obtain an AED and first aid kit. Proceed with gathering information from bystander using the sample questions. Conduct a head-to-toe check. Roll the person onto his or her side into recovery position if there are no obvious signs of injury. If the person is not breathing, send someone to call emergency hotline or designated emergency number, obtain AED and the first aid kit. Ensure that the person is spaced up on a firm flat surface such as the floor or ground. Begin CPR or use an AED if one is immediately available. If you are trained in giving CPR and using an AED, continues administering CPR until the person exhibits sign of life, such as breathing. An AED becomes available or EMS or trained medical responders arrive on scenes. What is basic life support? Basic life support or BLS generally refers to the type of care that first responders, healthcare providers, and public safety professionals provide to anyone who is experiencing cardiac arrest, respiratory distress, or an obstructed airway. It requires knowledge and skills in cardiopulmonary resuscitation or CPR using automated external defibrillators or AED and relieving airway obstructions in patients of every age. What are the proper procedures for performing BLS? Number 1 is position your hand above. Make sure the patient is lying on his back on a firm surface. Kneel beside him or place the heel of your hand on the center of the chest. Number 2, interlock your fingers above. Keeping your arms straight, cover the first hand with the heel of your other hand and interlock the fingers of both hands together. Keep your fingers raised so that do not touch the patient's chest or rib cage. Chest compression above. Lean forward so that your shoulders are directly over the patient's chest and press down on the chest about 2 inches. Release the pressure but not your hands and let the chest come back up. Repeat to give 30 compressions at the rate of 100 compressions per minute. Number 4. Open the airways. Move to the patient's head. Tilt his head and lift his chin to the open the airways again. Let his mouth fall open slightly. Number 5. Give rescue breaths. Pinch the nostril close with the hand that was on forehead and support the patient's chin with the other hand. Take a normal breath. Put your mouth over the patient's and blow until you can see his chest rise. Number 6. Watch chest fall. Remove your mouth from the patient's and look along the chest. Watching the chest fall. Repeat 5 steps and 6 once. Number 7. Repeat chest compression and rescue breaths. Place your hands on chest again and repeat the cycle of chest compressions. Followed by the 2 rescue breaths. Continue the cycle.